Hi, hello and welcome. This is Shilpa here, the author of HomeoQuest, and today we're going to study how to classify and understand remedies in terms of groups or kingdoms or sub-kingdoms and so on. Now, you'll ask me, why is that important? So in the last 20 years of my practice, being able to understand the entire homeopathic database of about 2,000, 3,000 remedies into groups has helped me tremendously. One, in being able to learn remedies 10 times more than you could ever learn. So if you can, a normal human can master about 100 remedies, group analysis will help you master 10 times more remedies than just your 100, and that's a fact. And the other thing you can do is you will be able to prescribe those smaller, rarer remedies with much more confidence and accuracy, and be able to tap into the entire potential of those remedies which are not well proved, not well represented in our Materia Medica because of patchy provings, and be able to actually give remedies with confidence even if they do not come up in your final repertorization. And this is tremendous, to be able to fine tune those prescriptions when your well-known remedies do not really work, when you think they should work really well, right? So that's the whole idea of knowing group analysis. So let's see how we do that. Right, so first I want to introduce you to this wonderful feature in HomeoQuest, which is remedy analysis. This is where we'll start working with groups. Now, last time we spoke about the basic simple options of remedy analysis. Check that video if you haven't looked at that, because that's tremendous. But today we are going to learn and study the advanced part of this remedy analysis, which is where we're looking at different kingdoms. All right, so we're going to get into the advanced options here. So let me take you one step at a time. So basically the idea here is we are now able to add groups of remedies into the selected remedy column here. All right, and you can access those. So if you click on this add a group feature, you can see all the remedies in our database are divided into different groups, animals, chemicals, colored pigmented groups, fungi, imponderabilia, nosodes, plants, sarcodes, and so on. And if you click on a particular group, say animals, then you can see all the different animal subspecies, and then within each species you can see subspecies and so on. All right, so lots of zoological, botanical names in there. All right, you can just collapse that. Other way of trying to access a particular group, say you want to access the spider group here. So all you need to do is type in the zoological name of that spider, say arachnids. All right, so you have the arachnids, the spiders, the scorpions, the ticks, the mites, etc. Let's just click on that group. So you land in the animal kingdom into the arachnids, and you have the different spiders. You have just the spiders, the ticks, the mites, and the scorpions. All right, within that big group, we'll just choose the big one, the spider group, and you have all the remedies in this column from the arachnids, and you can say add them. All right, so what happens is all the remedies in the spider group are added into here. All right, and now we want to find the common themes of the remedies in the spider group here. So what you do is we're going to use the advanced options, and we have three choices here. The first one is remedy count. What this will allow you is you can now choose how many minimum number of remedies in the spider group do you need to be in the common rubrics. So we are trying to derive the common rubrics of the spider group, and this particular remedy count will enable you to select how many of these spiders should be there in the common rubric. So say we select we want at least 3 remedies from the spider group to be there in this group. All right, in the common rubrics. The second is degree, which means what's the grade of the remedies you want in the common rubrics of the spider group. I'll keep this blank because I want all the remedies in every grade possible. All right. And the third one is rubric size, which means how big or how small the common rubric in the spider kingdom should be. Do you want large rubrics with lots and lots of remedies, or you want small rubrics? So in the rubric size, let's choose at most, I want 100 remedies. So it's a medium size rubric. So in the repertory filter, I want to select only the old masters. So I have deselected the complete and Jeremy's repertory. So we have only the old masters here because I want to check what the clinical data of these masters talk about. All right. Now, when I say analyze, we're going to get all the common rubrics of the spiders which has at least 3 remedies from the spider group and which has only 100 maximum number of remedies in that rubric in an entire database. All right. And let's look at what comes up. Loquacity, interesting. You have, that's the first, angina pectoris. I would never think of a spider remedy for heart angina issue, but this is interesting. 3 remedies from that family. Then we have jerking. This is important. Trembling, shivering, so a lot of convulsive movements and trembling. Chilliness. It's a very common, most spider remedies are chilly. Hysteria. How interesting is that? Then you have thigh legs, numbness, vomication, going to sleep. Chorea. So lots of nervous symptoms, lots of, hysteric symptoms, lots of convulsive symptoms and jerking, periodic aggravation, again, Clark's clinical, angina pectoris, and chorea. So very strong action on, the heart and on the brain. Toothache, nerves, completely depressed, neurasthenia, prostration. So how interesting. So this is like the full physical data of what's generals of all the spider remedies that comes up from the old text. Let's do another one. All right. So to do that, we'll clear up the spiders. So I have a clear button here. I'm going to clear up this group, and this time we'll take the plant kingdom. So which one do you want? Let's just type in, if you go to add group, if you look into the plants, you have lots of different plants families here, and you can choose the one you want from there. See, I want to look at the Compositae family. All right, the Asteraceae family, which is a sunflower. So 73 remedies in that family, a big one there. All right, and we add the remedies. So all these remedies are now from the Compositae family. And from this, let's do, the remedy count. Because there are so many remedies, let's have a bigger remedy count. We want at least 4 remedies from this family in the common rubrics. The other thing we want to do, let's not worry about the degree size, but let's have a rubric size here, and we restrict the rubric size. So at most, let's have 50 remedies, because this is a big group. We can, go a bit smaller, so we get a much more fine-tuned search. All right, and this time I'm going to choose some interesting books here. I want to choose only the Bonninghausen type books. All right, so I'm also going to remove Kent. I'm going to remove Fatek. I'm going to keep Bonninghausen, Boger, Boricki. We're going to use Clarkey. I don't want the Kenton repertory. Robert Sensation, as if I don't want. Let's keep Lipez and Danipkers. All right, and now say okay, because I want to look at the real physical symptoms coming up from this family and check it out. Right. So these are the repertories we use and analyze. Now look at that, what's coming up here. We have headstrong, obstinate, defiant, and stubborn. Who would have thought this is like one of the key mental symptoms of this family, the Arnica family, right? The injury family. Then sticking, stitching pains, look at that, nose bleeding, bright red blood. What other things are we getting here? They must change their position to feel better. They are aggravated by rest. This is a common lumbar region, as if it's broken. What else? Nosebleed is a very common thing in them. Spleen pain, kidney pains, calculi, bites of insects, snakes, and dogs. And then this is all we know. Eruptions, suppressed ill effects of with poisoning of roast dogs, surgical inflammation, stroma, post-operative, sprains and strains, septicemia, pyemia. So can you see how interesting you get the whole beautiful analysis of that entire family and coming up with remedies that you never knew of. I don't even know what this remedy is. Let's sort of look at that. Pyrethrum officinalis. Again, composite family. What is this? Plumbago. Let's look at that. Well, that comes up somewhere. Plumbago litoralis from Allen's. Let's look at what Clark was talking about. So it's a proved remedy. It's an unknown remedy. We don't even know what this remedy is. And, it is something for eye pain, inflammations, kidney pains, fever, and some peculiar symptoms here. Saliva profuse, ulcers, costiveness with red urine. So very strong action on the urinary tract and so on. So that's the beauty of remedy analysis, that you kind of start looking at so many different symptoms now from the same family. Let's do the mineral kingdom now. So we're going to clear this and we're going to add the group and looking at the chemicals here. So when you click on the chemicals, you open up the entire periodic table. All right. Now, say I want to only study the natrum group. So we're going to click on natrum. When you do that, you're going to get all the remedies, the elements, the compounds, all the different types of allotropes and all these aspects of the natrum. We have about 40 remedies that have sodium as an element in it. All right. And let's add it. So sodium's added here, and let's do quick analysis and see what are the group themes of the sodium group. Now let's take a remedy count of 3. Let's take the degree as 0, and the rubric size at most, let's have at least 100 remedies. And let's do a repertory analysis now, just from the Bonninghausen. Let's see what Bonninghausen says about sodium. We always know about sodium, and when we study remedy like sodium, we are looking always at the mentals. This is a very important way of knowing and getting a balanced understanding of your Materia Medica. So Bonninghausen will give you only those mentals that you really need, plus it will give you some beautiful physicals and give a really balanced. That's the reason I love Bonninghausen. Let's do it only from the Bonninghausen, and let's see what he has to say about the natrums. Okay, there we go. The first thing he says is depression. All right. Then what else? Gentle, mild, and tender. Lots of natrums in there. Ill humor and cross. Indolence, aversion to work. So picture a depressed person with, cannot work, indolent, satiety of life, with lots of ill humor and cross. Malicious and wicked, but peevish and fretful. They're very silent, they're mute, they can be violent, but that's all internal. They're weeping and tearful, and they're much more, that sort of a silent inward grief, inward depression, that type. They're gentler and milder and keep things to themselves. And then let's look at what else coming up. So imagine a depressed person who has headaches and who has vertigo, falling to the left, different types of head pains, which is aggravated reading and eating after, hair fall with depression, dry itchy eyes and lacrimation with or lacrimation. So both, natrum has both the dryness, itching, as well as lacrimation. So say hay fever with depression. What else? Paralysis of the optic nerve, uh, paralytic deafness, acrid discharges, blisters on the chin or the lips or the lower lips, say they have herpes along with depression. So can you see, it will give you a beautiful analysis and a beautiful sphere of action of where the natrum group is heading towards, and that is how you can study natrums, calciums, magnesiums, kalis, and that will help you reinforce. And you can use different repertory filters, you can use different remedy counts and rubric sizes, and just play with this, because this is such a beautiful way of learning a Materia Medica and having a balanced understanding, not just the mentals but also the physicals, the physical generals, the particulars, the modalities, and you get this whole. So you will, when you're looking at a depressed person who is with hair fall and herpes and inward silent grief, you will not just think of natrum mute, you'll think of other things as well. And then you don't have to just stick with one particular element or one particular anion or cation. If you look at the groups and if you look at the chemicals here, you can also select a row or a column. Say I select the entire row 4, which is the iron series, and all the remedies in the iron series that are, and their compounds and their allotropes all come up in your analysis. So 227 remedies, and you can add all of them and do an analysis there. You can select a particular column. So I want to just select all the remedies in column 10. So this will select all the remedies, all the metals in the top of the periodic table at the very up, in the middle of the periodic table, G10. And then you can do an analysis of these remedies. So there is no barrier here. You can select groups, you can select columns, you can select kingdoms, sub-kingdoms, and you can basically learn the Materia Medica from so many different facets. And that's the beauty of group analysis. So now the question is, how do you use this when you are prescribing for your patient? That's the most important part here. All right, so what we are going to do here is I'm going to actually talk about a case. It's a case of severe migraines, and this was something I had taken a long time ago. It was a friend of mine who was pregnant, and she came with severe migraines. All right, and I'm going to give you a brief idea of what and how this case came up. So she basically was, I knew her since medical school, and she always mentioned that she wanted to, go and dedicate her life for the rural community. So that's what comes up in the mentals. She and her husband, he was an architect, and he used to build eco-friendly homes, and they went and got themselves a piece of land in a rural farming community, and they went and she was building her own bamboo home. She was giving natural medicine to the farmers around, and they were setting up their life there, and they were extremely busy, everything hands on. They had to build their own house, they had to grow their own veggies, and not just veggies, grains and things, wheat for the entire year and rice for the entire year. And they were like extremely busy. They had a few cows and dogs and cats and chickens, and that was like their life, and they were extremely busy. And this was when she was pregnant, and she developed these severe migraines when she came to me. And the migraines were very typical. There were this severe violent pains that she had from the eyes or the eardrums on the left side, and they used to extend to the back of her head. And they were so strong, it was as if a rubber band was stretched across. And she mentioned that it was this tightness and tension, and that rubber band sort of pulled, it stretched to its limit, and it released, and it pulled and it released. Imagine that sort of. She was very vivid in giving her symptoms. And she had taken loads of homeopathics. I mean, done everything possible, all possible remedies you could think of for migraines or for her constitutional were given to her. But this pain was just not lending. I mean, she was living a life that she loved. She was busy, extremely, dedicated to what she wanted to do, but she didn't understand why should she have such severe migraines during her pregnancy. And she said it's similar to the period pains that she used to get. It's exactly the same, when the uterus contracts and relaxes, it was that extreme pain. Somebody in labor, that's the type of pain they would have, but I get it in my head. All right. And then we got a few other things. We didn't go into the mental because she was a friend and quite close, so I just couldn't. But she said there were two or three, one very strong nightmare. She felt somebody's pressing down her chest, and it was like a heavy load or a heavy pressure, like a stone, and she is frantic and desperately trying to breathe. So that was the case. Basically, that's all I got, and I was like, what do you do? Now, when I tried to repertorize it, this was like such, these are very peculiar symptoms. So when I put in, contracting, expanding, or alternating, or this pulling, tension, tightness, you got like hundreds of remedies, all different types, but it was breaking up my symptom. There was not really something, this beautiful sensation was just not coming up in any repertorial totality. And then there were hundreds of remedies with something pressing on the chest, or but it just didn't really bring up the whole beautiful aspect of how this whole process was. But one thing she was talking about, which made a lot of sense, is this whole aspect of contracting and relaxing, contracting and relaxing. And she started, putting her fist, gripping her fist and relaxing her hand, and gripping her fist. And this, for me, from my understanding of Materia Medica, was like the sensation of, the cactus remedy. It's a heart remedy. And I remember Materia Medica lectures of cactus, as if the heart contracts and relaxes, or constriction and relaxation of the hands, that it's as if it was grasped by a hand. So she was describing that same sensation as if the cactus heart was, right? And the cactus glandiflora, if you read all that, that's what happened. It reminded me of cactus, of the heart clutched and release alternately, as if by an iron hand. It expands and contracts and alternates with relaxation. And we gave her cactus, I think, but it just did not do anything. It gave her some relief, but the pains just stayed very strongly. So that was when I decided to look at the cactus family. Okay, because I thought there must be so many other remedies I don't know in the cactus family, and these pains and these, so important. So I'll do a very quick remedy analysis of the cactus family here. So we'll just go add a group. Let's look at the cactusy, and let's add not a lot of remedies, about 8 remedies, so not a very big family here. So we have to be, this is what we have. So we're looking at what remedies have this strong focus on the occiput. And as you see, cactus comes up because it's the most well-proved remedy. So let's look at some other, if there are some other remedies from this family, and look at that. There is something called miserably. And it has this thing about bowed bound to occiput. This is interesting because she had something like a rubber band was bound to occiput bowed. So let's look at this remedy, I thought, and it's serious bon planty. And when I'm reading in the Ellen's encyclopedia, we have desire to engage at work, desire to have the time all employed, inclination to be engaged in something useful. That's interesting because she's dedicated her life to the rural community. What else? Let's look at the head feelings. Feeling as if the head was suspended from some support under the skull, felt drawn to the left backwards. Interesting. I like Boriki, desire to work and be doing something useful. Look at that. Occipital headache, pain through the globe of the eyes and the orbits. That is spot on there. What else? Sensation of a great weight on the heart. Difficult sighing respiration as from some compression of the chest. It's like, how wonderful is that? What else? Clarkey. What does he say? A few things here. Look at that. He felt weighed down by an incubus. Pains through globe of eyes to the occiput. Wants to be at work on something useful. And there we go. She got Ceres Bonplandy. And the first time she came in and she said, that was like the relaxation and the peace that she never had. That was what she always wanted to do and get when she went to the rural community. She was in Mumbai, in a busy city, constantly stressed and stretched to the extreme. And this was the relaxation that she had never had. And for the first time, she could breathe and relax and enjoy her life. And for the first time, those migraines just, disappeared. So can you see, serious Bonplandy, who knows what remedy that is? And I've never actually known that. All I knew was cactus, but just looking at the group analysis got me to something which was interesting, got me to look at those remedies, and that was what she got. So this is where it expands your scope, it expands your Materia Medica, it expands the reach. Just using your basic books, and you can create those results for your patients. So hope that helps you, and hope that helps you understand remedies and remedies as groups and remedies and analysis so you can give the best to your patients as well. So hope that was useful. You take care, and I'll come back to you with another interesting feature and another interesting tutorial. Thank you. Take care.